Today we are running through the features and functionality of the BabyWorks training simulator, designed to meet the core pediatric and neonatal ultrasound training requirements for intensive and emergency care, acute medicine and cardiology. BabyWorks is born out of two world-leading high-fidelity simulators, BodyWorks and HeartWorks. BodyWorks uses cutting-edge technology to effectively teach PoCUS skills, while HeartWorks has all the advanced functionality needed to teach echocardiography. BabyWorks brings these two platforms together to revolutionize teaching neonatal and pediatric PoCUS and echocardiography. BabyWorks Sam is a high-fidelity baby mannequin which allows trainees to learn to acquire images in a safe, calm environment. Trainees can scan from the clavicle to the pelvis and 3 cranial windows using key palpable landmarks to find the correct imaging windows and compensate for obstructions, just like in real life. The micro multiprobe allows for scanning in both trans-abdominal curvilinear and transthoracic cardiac modes interchangeably. And the micro transesophageal probe allows for more advanced echocardiography training. BabyWorks uses real pediatric ultrasound cases covering the brain, heart, lungs, abdomen and bladder to teach PoCUS skills, while cardiac skills are taught using an exceptional 3D anatomy and sophisticated Doppler with both continuous wave and pulse wave, with both transesophageal and transthoracic modalities. Our cases and pathologies have been developed in collaboration with leading experts from around the world, including those at Great Ormond Street Hospital. There is no better way to learn neonatal and pediatric point-of-care ultrasound and echocardiography. BabyWorks enhances PoCUS learning in several ways. For self-directed learning, we have 56 PoCUS cases available on the system to test diagnostic skills and develop pattern recognition for normal and pathological appearances. Organised by anatomy or CACTUS protocol, accredited by the Pediatric Intensive Care Society, the patient lists on the system cover brain, fluid in the potential spaces, the lungs, gastrointestinal, renal and the bladder. Trainees can work through these cases independently, at their own pace, with cases loading in a randomised order so that the workflow will be different every time. For tutor-led teaching or assessment, the active scenario mode allows the tutor to use the handheld tablet to instantly change the baby's condition, to test decision-making skills in a pre-clinical environment. Tutors can control the heart rate, respiratory rate, and the pathology in any area of the patient by simply clicking on the relevant anatomy and choosing from the list of pathology cases. The pathologies on the system can be used in any combination, giving the tutor thousands of possible patient cases to use and adapt to the trainee's skill level. This flexibility means that the tutor can incorporate trainees' findings and responses into the scenario and adjust as necessary. Tutors can also open any of their customised cases from the tablet and use them in a supervised scenario. The PoCUS scanning interface consists of the ultrasound fan, the clinical information, and the ultrasound control panel. The ultrasound controls comprise TGC, depth, zoom, focus, sector, and gain. Within the mode menu, users will find options to turn on colour Doppler or M mode and switch between the abdominal and cardiac probe footprints. Users can then take a deeper dive into echocardiography with the advanced cardiac platform, perfect for learning transesophageal and transthoracic echo. The anatomically accurate and fully interactive 3D heart is a useful tool to build understanding of how 2D images relate to cardiac anatomy and EKG traces. The 3D heart can be moved, sliced in any direction, slowed or paused. The ultrasound fan slice interacts with the model to aid probe manipulation while scanning. Another useful tool is the gold standard imaging planes, which trainees can use to check their acquisition of the standard views. There are gold standard imaging views for all of the standard TTE and TEE imaging planes. Furthermore, trainees can use the inbuilt textbook to learn more about any of the 140 structures of the heart and see which imaging plane is best for examining that particular structure. The echocardiography controls are comprehensive and in addition to the standard PoCUS controls include pulsed and continuous wave Doppler, biplane imaging and an extensive measurements and reporting package with step-by-step guidance. pulsed or continuous wave Doppler information can be obtained from any part of the heart or great vessels, allowing students to learn accurate cursor positioning. And users can adjust both the velocity scale and baseline and angle correction to acquire accurate spectral traces. Become confident in pediatric and neonatal point-of-care ultrasound and echocardiography with BabyWorks Sam, and make a tangible difference in patient care today.